Hi, Dr. Manan. Hi, Dr. Vaibhav. Welcome to the Dental Spotlight. Thank you. And a pleasure being on the other side and asking you some quick questions. Yes. Of course, we all have been there in the social media paradigm and we've been there and done that. But what do you think with all these campaigns and all of these personal inroads that people are wanting to make? Was that fine line between ethical social media marketing versus influencing? And influencing means, of course, rubbing people the right way and maneuvering their attention and their span towards the correct direction. So, what's your take on that?
Yeah, that's a very interesting question because we live in a day and age where the first 3 seconds of the opposite person's attention span is the most important. And I see a lot of people in the health space, they may not even have health qualifications, but health content creators trying to grab people's attention in different ways. And it's probably easier for them, but we need to understand that whether doctors, dentists, we have a medical or a dental body regulating us. We were kind of representing our own community. So that's where we need to differentiate ourselves from the others and try to be true to ourselves when we're putting information out. I mean, I think throughout our journey in education and starting practice, we kind of get ingrained with how we would communicate with our patients. So the idea is to just take that sentiment and replicate it online. Just because that is, each person listening to you is not a direct patient doesn't mean your approach needs to probably change. As long as you have your head in the right space and you're following the regular ethical guidelines, something that helps you sleep peacefully at night. I just like to say that, right? Because beyond a point, no one's regulating social media. So as long as you're putting stuff out there that helps you sleep peacefully at night, something that is sound advice that you would give your patients, your family, your relative as well. I think that's where you can draw the line and say, okay, I'm comfortable saying this or I'm not comfortable saying this.
Great. So, you also said about regulation of social media. Are you aware of the recent social media guidelines that has been prescribed by the ministry? And if you could share some quick points on that for everyone to know,
Yep.
because everyone's on social media. People are novice. People are just starting off their journey. So I think it'd be something great. Some quick points.
Yeah, so basically the ministry has, tried to imply that everyone needs to be very transparent about anything that they're doing. So whether it is your own background, your own qualifications, your own education, you should be very vocal about it and mention it, as well as any sort of promotions you're doing, brand collaborations you're doing, you should kind of disclose it. The one thing I feel we should definitely stay away from is like taking drug names or giving direct treatment advice as a, one is to all approach on social media, because that is what a lot of people are doing. And the consumer is kind of taking that piece of advice, applying it to them, and then there are obvious repercussions that are possible. So that is one thing that everyone needs to stop doing, is not assume a one is for all approach. Social media is great for awareness, it's great for education, but it's not a tool for treatment. And anyone listening to social media advice should also not assume that each piece of information they consume is actually treatment. It's not necessarily treatment. Get educated, get aware, do your research, consult your specialist, and then take it forward. That would be the right way to do it.
And of course, you're a doctor, you're a practicing orthopedic specialist, and all of that. But you're also having a great space and you grab a lot of attention on social media that can have its yin and yangs, of course. So, but what is your thought process regarding that particular construct of creating a social impact, but also ingraining and carving a niche in the public health space by talking about issues and talking about very pertinent problems that can require fixes?
Yeah, absolutely. Because, when you're seeing patients in person, you can only see or treat X number per month. But this allows me to reach lakhs and millions every month. So there's definite benefit in doing that. Definitely when we speak about public health issues or in general speaking about prevention, because one thing I like to do is speak about health and well-being in general, not just speak about how your bones break, right?
Yes.
I'm more of a health creator rather than an orthopedic creator, because I genuinely believe that I'd rather speak about health than disease. I'd rather speak about prevention than cure. So it's very important that we, kind of get the public aware on these aspects, let them know what they can do before you need a doctor in the first place, rather than just providing treatment solutions all the time. So that has always been the motive and the crux, that I have. Coming to other general issues or topical news related to health, I like to cover those things as well, because it's really important for the audience to get to know this first up. People are scrolling more than they're reading newspapers now, so they'd rather get that information right here. So it just gives us a platform to put out all that information right there and get the public aware about everything. So I love the journey as well.
Great. And to conclude, what's your take on oral health? I know it may be a difficult question, but what's your take on oral health, and how important do you think that it is to make oral health available, accessible, affordable, and affirmative to the entire population?
No, I think it's super important. It doesn't get discussed as much compared to something like heart issue or a liver issue for that matter, but oral health is just as important as any other system in the body. We now have research and data that suggests that so many other diseases kind of originate from poor oral health and everything that follows after that. So I think it's really nice that there are initiatives like this. There are so many dentists in the country who want to educate the audience and create more and more information regarding better oral health and better oral health practices. So I'm very happy about that.
Thank you so much. And yes, oral health is important, and oral health is a very important construct of general health and overall well-being.
Absolutely.
So with that, thank you very much. It's been a pleasure speaking to you.
Thank you so much.
And we'll be seeing each other on the informal side.
Yes, absolutely.